afternoon. This is Professor McGinley, and today we're going to discuss adaptation to pregnancy, both physical and psychological. Although pregnancy is a life-changing experience, it is not always embraced positively due to the physical changes that may range from nuisance side effects to severe life-threatening events. There are a variety of psychological issues related to pregnancy also. Think about it. If we told you to expect a baby into your life in the next 9 months, how would you feel? How would it affect your life plans as they stand today? The Khan Academy videos, Maternal Changes in Pregnancy and Pregnancy Physiology 1, address the physiologic changes associated with pregnancy. These changes affect the physical nature of pregnancy. It is important that you understand the role of beta-HCG, estrogen, progesterone, relaxin, and human placental lactogen in causing physical changes in pregnancy. In addition to the information in that lecture video, there are a few other changes you should be familiar with, including immunosuppression, hemodilution that results in edema, vena cava syndrome, and an increase in cortisol production during the later trimesters. We will start with immunosuppression. Because the fetus is a foreign body, the pregnant condition automatically enters into an immunosuppressed state in order to avoid rejection of the fetus. As a result, pregnant women are more at risk for infections, especially communicable diseases such as influenza and varicella. Therefore, as nurses, we screen women in regards to immunization status and encourage them to receive a flu vaccine during their pregnancy. Edema is a common physiologic response to pregnancy and worsens as the pregnancy progresses. Significant edema that occurs during the first and early second trimester is a red flag for potential problems such as gestational hypertension. We will talk about this in a separate lecture. As hemodilution increases, the colloid oncotic pressure decreases, therefore fluid shifts into the third space, causing edema. In addition, as the uterus increases in size, it puts pressure on the veins in the lower extremities, therefore reducing flow back to the heart. As a result, most women experience some degree of edema in the feet and ankles. Some women gain up to 10 pounds due to dependent edema, and will usually see this in the last month of pregnancy. The weight of the gravid uterus also contributes to vena cava syndrome. The Khan Academy video refers to this as supine postural hypotensive syndrome. This is the same thing. In a supine or a forward flexed position, as in leaning forward to reach your keyboard when using a computer or bending over to tie your shoes, the uterus compresses on the vena cava, resulting in orthostatic hypotension. The woman will complain of typical symptoms of feeling lightheaded, dizzy, and/or nausea. As her blood pressure decreases, perfusion to the uterus and ultimately the fetus decreases. As a result, decelerations of the fetal heart is seen on a fetal monitor or can be heard with a fetal Doppler. For this reason, we encourage pregnant women to lie on their side, and preferably on their left side. The last physiologic change we're going to discuss is cortisol. These levels increase throughout pregnancy, especially toward the late second and third trimester. This increase results in a certain degree of insulin resistance, which leads to gestational diabetes, abbreviated GDM, in some women, and GDM will be explored in a separate lecture. Let's move on to the psychological adaptation, and we'll begin with maternal role transition. You can see the different stages that a woman must go through throughout the pregnancy. In the first trimester, it is not unusual for a woman to feel ambivalent about being pregnant, even if she was trying to conceive. Now it is real, not imagined. Therefore, a certain degree of anxiety occurs. Is this the right time? Will I be a good mother? Should I have finished nursing school first? What will my partner think? What will my other children think? She may not be happy about how she feels, especially if excessively tired or nauseated, and she still needs to complete all of her responsibilities day in and day out. Some women may fear the physical changes associated with pregnancy, leading to our nursing diagnosis of disturbed body image. Early in the pregnancy, she is in the seeking phase. She needs a safe environment for herself and her fetus. She selects a provider for prenatal care, begins vitamins, and gets advice from her family in regards to cultural practices to ensure a healthy pregnancy and baby. Now, some of these cultural practices may not be accepted in Western medicine. It is important to the pregnant woman that the father of the baby accepts the pregnancy. It is a relief, in fact. If not accepted, this creates anxiety as the pregnancy progresses. The woman worries, how can she make it on her own if he never accepts the pregnancy? How will this baby impact her life? She wonders how her other children will accept another child into the fold. In addition, many pregnant women seek acceptance from their own mothers. And if at any time there is anxiety that she is feeling from the father, from the children, from her family, her cortisol levels may increase. As the pregnancy continues, the pregnant woman begins to modify her own identity from wife or significant other, worker, housekeeper, mother of one to mother of multiple children. The woman learns to give of herself. There's less focus on her, and she begins to put more focus on the growing fetus, accepting and embracing the body images and realizing that this is necessary for good fetal growth. She commits to her unborn child by following the guidelines for prenatal care and modifying lifestyle. She shares her baby's activity patterns and growth with others, in conversation and in pictures, and some even share the ultrasound photos. Once the baby starts moving, there is more and more emotional bonding that takes place. This baby is real. It is also important that the family goes through an adaptation process because they will be experiencing role changes. The father of the baby may or may not be excited. There is a certain degree of worry related to the financial burdens of raising a child. He may feel insecure in his relationship and wonder where will he fit in once the child is born and occupies the time and attention of his significant other. He is also concerned about the health and well-being of his partner as well as the baby. He may be ambivalent, nervous, or afraid to participate in the birthing experience. It is important to include the father in the prenatal office visits. He should be encouraged to attend the prenatal education classes with his family. With his partner. Some institutions provide special classes for fathers only. For example, St. Joseph's Hospital in Orange has a Daddy Boot Camp, men only, and this includes only male nursing students. Other members of the family must adapt. Grandparents may or may not be happy about the pregnancy, especially if they are already caring for grandchildren or they have concerns about the relationship between their daughter and her significant other. They may be concerned about how much they will be allowed to participate in the birthing experience. It is hard to predict how siblings of the new baby will adapt when told of the pregnancy. Younger children really can't understand what it means to be pregnant. Even when the baby comes, a toddler may look at the mother and tell her to take the baby back because she doesn't understand that this is a part of the family. Older children are more capable of understanding what pregnancy and a new child means. However, the child may wonder how they will fit in now that a new baby is in the picture. Some adolescents, while accepting of the pregnancy, still feel embarrassed to share the news with their friends or to be seen in public with their pregnant mother. Because after all, if she is pregnant, it means she is having sex. Other issues that affect adaptation include being a teen, a single mother, repeated pregnancy loss, socioeconomic factors and/or lifestyle problems, being homeless, drug or alcohol use, or having no social support. All of these can present as a barrier to prenatal care. Some women have fear. How will the partner react when told of the pregnancy? If there's a history of recurrent pregnancy loss, will this pregnancy end the same? Therefore, if she doesn't get prenatal care, it's a means of denying that she's actually pregnant. Some women prefer getting advice received from others rather than from an obstetrician or a nurse practitioner. Organized medicine may go against cultural beliefs about pregnancy. Some women see pregnancy as a normal, healthy condition, and there's no need to have any type of Western medicine care. They may seek a lay midwife closer to the due date and decide to deliver at home. In early pregnancy, a woman may be ambivalent about continuing the pregnancy. In this case, there is no need for prenatal care if she decides to terminate. Many times at the first prenatal visit, a vaginal ultrasound is performed, and the provider is very excited to show this fetus to the pregnant woman. But if she's uncertain about if she's going to continue the pregnancy, she doesn't want to see it because it makes that choice more difficult. Some adolescents or victims of domestic violence may deny or hide their pregnancy from others for fear of reaction by their parents, friends, teachers, or from the abuser. In fact, some of these women end up coming into the emergency room complaining of unexplained abdominal pain, only to find out that not only are they pregnant, but they are in labor. And last but not least, uninsured women do not seek prenatal care due to the expense. The state of California has legislation that provides free prenatal care to the uninsured and low-income women. It is in the state's best interest to provide good prenatal care to improve pregnancy outcomes instead of having neonatal intensive care units full of babies that are preterm or have other problems because their mother did not have the money or resources for prenatal care. This lecture discussed a few of the physical changes and a variety of psychosocial adaptations that occur during pregnancy. It is important for the nurse to listen to and address a woman's concerns regarding the multitude of changes that occur. The nurse needs to support the pregnant woman during this transformation to motherhood. The nurse needs to recognize when a woman is not adapting to pregnancy as expected and notify the obstetrician or the nurse practitioner. In addition, the nurse should refer this patient to counseling, childbirth education, newborn care classes, and parenting classes that are offered within the community. Thank you for listening to the lecture on the physical and psychological adaptations required in pregnancy.